Crohn's disease is a pathological condition that involves the inflammation of the bowels. This means a person with Crohn's disease will have severe digestive tract inflammation. Crohn's disease is characterized by a number of related conditions which include fatigue, acute diarrhea, pain in the abdominal region, loss of weight and malnutrition. Crohn's disease affects different parts of the tract and its action runs deep in the tissues. Although there is no specific treatment for Crohn's disease, experts suggest certain therapeutic measures in treating accompanying symptoms. These symptoms are often with great pain and could prove fatal. Even though there is no specific treatment plan for Crohn's disease, certain measures to improve the symptoms can save your life.
Welcome to Simplified Health Tips. I'm Andrew. Today Michael and I will be covering everything you need to know about Crohn's disease, including its causes, symptoms and treatment options. So tap the like button, smash the subscribe button and let's go. So, Michael, you've already told us what this condition is, but what are the symptoms of Crohn's disease?
Different people with Crohn's disease will experience inflammation in different parts of their tract. For example, some people might have their large intestine inflamed, while in others it can be at the base of the small intestine. These are two most common areas where inflammation may occur. The symptoms associated with Crohn's disease may be just mild and acute or severe and chronic. The symptoms may develop from mild to severe over time. They include fatigue, severe diarrhea, pain and cramping in the abdominal region, blood in feces, increased temperature, loss of weight, sores in your mouth, and inflammation of the anal sphincter. However, for chronic cases of Crohn's disease, the symptoms include skin, eyes and joints may become inflamed. The liver or bile ducts become inflamed. Children might experience stunted growth or delayed sexual development.
Oh no! I really didn't know it was such a horrible condition. Michael, what causes Crohn's disease?
Medical experts are still at a loss for the exact cause of Crohn's disease. They have had several suspicions as to its cause. These suspicions include malnutrition and stress, but there is no definite result. Poor diet and high stress levels can worsen a condition of Crohn's disease, but there is no evidence that it can actually cause it. Certain factors are known to increase the risk of developing Crohn's disease. They include weak immune system. Certain microorganisms in your environment can activate symptoms of Crohn's disease. A weak and ineffective immune system is not equipped enough to protect you from these microorganisms. The microorganisms may include bacteria and viruses. When the defective immune system even tries to fight the organism, it causes harm to the tissues of the digestive tract up to the cell level. Heredity. Studies have long established a relationship between a person's family's medical history and that person's health status. You are more susceptible to developing Crohn's disease when someone in your family has previously had the disease.
Who's most at risk of having this disease?
Further research into the cause of Crohn's disease has led to discoveries about certain factors that make you more susceptible to Crohn's disease. They include ethnic group. Medical researchers believe there is a correlation between ethnicity and your risk of getting certain diseases. In this case, Caucasians and Jewish people are more likely to develop Crohn's disease. However, blacks residing in North America and the United Kingdom have recently been seen to develop the disease in increasing numbers. Genetics. People with family members diagnosed with Crohn's disease are at a higher risk of developing the disease themselves. Age. Most people diagnosed with Crohn's disease are relatively young, under the age of 30. Although you can experience the disease at any time and any age, it is more common in younger people. Smoking. You may not be able to control your genetics, ethnicity or your age, but you can definitely control the amount of cigarettes you smoke. Smoking leads to a severe case of Crohn's disease and prevents improvement in your health even after treatment. Nonsteroidal anti-inflammatory drugs, NSAIDs, although they do not lead to a case of Crohn's disease, they can significantly hurt the digestive tract, thereby worsening the disease. Medical experts advise you consult your doctor before taking any form of NSAIDs. Environment. It is not surprising that your immediate environment is also a contributing factor in the development of Crohn's disease. If you live in an area populated by industries, like an industrial hub of sorts, you are more likely to develop this disease.
Being that the symptoms are so serious, what are some complications that may arise from having Crohn's disease?
Certain complications can occur if the symptoms of Crohn's disease are not treated properly. These include obstruction of normal bowel movements. In severe cases of Crohn's disease, the walls of the intestines are greatly affected, and this leads to narrowing of the intestines. When this occurs, normal movements in the bowel become obstructed and surgery is required for correction. Ulcers. Severe cases of Crohn's disease can cause you to develop ulcers in various parts of your body. Anal fissure. This is a painful cut or bruise in the anal tissue and could lead to infections in that area. Malnutrition. The symptoms of Crohn's disease you experience might make you decide not to eat, and this will lead to malnutrition. Even when you try to eat, your intestines cannot function properly in retaining nutrients to keep you nourished. Fistulas. This is a severe complication of Crohn's disease that involves an abnormal connection between various body organs. Anal fistulas are the most common. Fistulas in the intestine can cause the bypassing of the normal digestive process. Colon cancer. When this condition worsens and the symptoms are not treated, you have a high risk of developing cancerous cells in your colon. Other severe health conditions. This disease could ultimately lead to certain complications in your general health. Some of these conditions include disorders affecting the skin, diseases affecting the liver, arthritis and osteoporosis.
Is there any way to prevent this disease?
Due to the severity of this disease and the lack of a specific drug, prevention is the best approach to Crohn's disease. Eat a healthy diet. To boost your immune system and foster general health, what you take into your body should not be overlooked. Eat healthy to stay healthy. Avoid foods rich in fats and bad cholesterol as much as possible. Regular medical checkup. The key to effective management of any ailment is early detection. This is only possible when you pay attention to the changes in your body and engage in regular medical checkups.
So, how is Crohn's disease diagnosed?
For the accurate diagnosis of Crohn's disease, the doctor in charge is required to carry out several tests to ascertain the correct diagnosis. Blood tests.
Test for infections or anemia. Anemia is a medical condition characterized by insufficient amounts of red blood cells to carry oxygen to the body at tissue level. Fecal blood test. In this test, the practitioner tests your fecal sample for any trail of blood.
The doctor can also request for certain procedures to be done that will help in his diagnosis.
Colonoscopy. Magnetic resonance imaging, MRI. CT scan, computerized tomography. Capsule endoscopy, and balloon-assisted anoroscopy.
Okay. What are the treatment options for Crohn's disease?
At this moment, there is no treatment for Crohn's disease. In a bid to manage the symptoms, medical experts utilize some medications that will help to reduce the inflammation that causes the symptoms. Anti-inflammatory drugs. These drugs are the first medications administered to treat inflammation. Some examples are corticosteroids. Although corticosteroids are not a guaranteed solution for Crohn's disease, they help in reducing inflammation. Examples include budesonide and prednisone. Oral 5-aminosalicylates. These drugs have been recently discredited as efficient against Crohn's disease. They include sulfasalazine, mesalamine, etc. Immune system suppressors. These types of medications also reduce inflammation. They do this by reducing the activity of your immune system. When there is an infection, the immune system's natural response is to trigger inflammation. These drugs help to prevent that. They include azathioprine and mercaptopurine, methotrexate, certolizumab, pegol and infliximab.
Outside of drugs, are there any lifestyle changes or home remedies that can help with fighting Crohn's disease?
There are a couple areas to pay keen attention to. They are: Number 1, a healthy diet. What we put into our body is very important because it determines our health. Consuming an unhealthy diet can aggravate Crohn's disease. It is important to record daily calorie consumption. Here are a few healthy tips concerning diet.
Reduce consumption of dairy products.
Choose foods that are low in fat.
Reduce fiber content in your food. Reduce unhealthy foods like spicy food, caffeine and alcohol. Reduce the quantity of meals you take. Ensure you consume enough liquids. Include multivitamins. Consult a professional dietitian.
Number 2, your stress levels. Stress may not directly cause this disease, but a person with Crohn's disease might experience worsened symptoms if he is under stress. Certain measures can be taken to reduce the stress levels.
Regular exercises. Biological feedback. Relaxation exercises and stress-relieving activities.
What about alternative medicine? Any options there?
Nutritional and herbal supplements. Many producers of herbal supplements boast of its many advantages. Because there is no organization to examine the products, it is not a guarantee. Always consult your doctor before consuming anything without a prescription. Probiotics. Probiotics are used when a person is on remission from Crohn's disease, even though there is no evidence to prove probiotics cure Crohn's disease. Fish oil. Certain research on the many benefits of fish oil shows promise. It is helpful in managing Crohn's disease as well. Acupuncture. There is still an ongoing research about the many benefits of acupuncture. However, it is not a proven cure for Crohn's disease, but in many cases, has helped to improve the symptoms. Prebiotics. These are compounds found freely in nature. They can be gotten from plants like artichokes. Although there is no major evidence to prove it is perfectly suited for curing Crohn's disease, it is included in the treatment.
Thanks again, Michael, for bringing our viewers facts about Crohn's disease.
It's my pleasure, Andrew. Thanks for having me.
Remember, viewers, to share this video with anyone who may find the information helpful. See you next time.
Thank you for watching to the end of our video. If you found the information helpful, please like the video. Also, don't forget to join the family by subscribing to our channel. See you next time.